Okay, why do I like the Posterior Lateral Arthrodesis by Minuteman from Spinal Simplicity? There are two main reasons. One is safety, and the other is reproducibility of the procedure. Number one, safety. As you can tell, even though I'm in my own procedure suite and I'm working on an artificial cadaver, I'm still using lead and lead glasses to be safe. That's very important in my practice with all the exposure I get. So if you look over here at the C-arm, you will see this is not a guide wire, but it's a needle going between the spinous processes safely and easily. And if you look at the lateral view, you can see that it's very anterior here, but it is not going to go past the facet shadow. And that's very important because that is going to keep it from violating any structures such as neural elements, such as vascular elements, and it's very important to be able to do the procedure correctly. So along with safety of the actual implant, we also have less tissue that is damaged from this procedure because we come in from a small incision on the lateral aspect of one of the sides. We have no violation to the supraspinous ligament, and we have no violation to the multifidus muscle, which keeps us from having problems with vascularity or nerve problems long term. And we all know what denervation of the multifidus looks like. So very important is this procedure is safe for us to be doing as pain doctors, and it's no more difficult than any of the things we do like pain pumps or stimulators. In fact, it's even easier with the reproducibility of the steps involved. Number two is reproducibility of the procedure. In our practice, what we are seeing is patients, regardless of how severe their pathology is, whether they have a pretty tight spinal canal or just a little bit of mild stenosis, or if they have just a little bit of slipping or they have a lot of slipping or these other indications we use, we see that the results have been reproducible. And I like that because that means that regardless of the person I put on the table, if I go through the simple surgical steps that we use, we can find good reproducible results, and we know our patients' outcomes are going to be good. Outcomes as quickly as 1 week or so feeling better and getting active and more functional in a quick fashion is the way we're getting our patients back on their feet faster. So if you want to know why I like the posterior lateral approach, it is going to be safety, reproducibility, and we're getting great results with our patients in our practice.